right? The left arm, the left leg. And making sure that the left leg isn't having foot drop, right? Because you want their feet to be pointing up toward the ceiling, okay? And you want to make sure that the scapula, the extremity, the upper extremity, lower extremities, and feet and everything are in alignment, okay? Her head isn't this way, right? But she's sitting upright. Make sense? Okay. All right, just lay down. Right? So we had talked about, Mr. Thompson, was, what I asked him was, if I have her in prone, how do I put her into supine? Okay? And we were discussing laying her on her side first, and then going into turning her on her back. All right? So I'm here. Which way you think I should turn her to lay her supine if she's right here? This way or this way?
You said she's a what seat?
I think you
Right.
should do that.
So what side should I be on?
The strong side.
Am I on the strong side?
No.
Yes,
like CPA.
Right. So you always want to be on the patient's unaffected side, right? And do you go from the strong side to the weak side or the weak side to the strong side?
Weak side to the strong side.
Which one?
Weak to strong. Yeah.
So I'm gonna go from the left side to bringing her to the right.
No, you can go
Or I'm
the
gonna
other
go
way
to the
you
right
want
to the left.
from the right.
Like to the left.
Right. Because how can she help me if I go from the weak to the strong? Right? Because you always want your patients to do what?
To help.
Assist you as much as possible. So I'm gonna go from here to here. Everybody got it? Okay. Right. So Miss Rayleigh, bring this arm down. Put you here. Now what I want you to do is use this hand, and you're gonna push up. Okay? And then I'm gonna assist you as well.
Can't believe it in Thursday.
Huh?
I can't believe it's Thursday. I thought it was.
That's because it's throwing y'all because of the day we weren't here. Okay? On the count of three, if I had a draw sheet, I'll be here with my draw sheet. Okay? We're gonna go 1, 2, 3.
Do you always cross the legs like this?
I do.
Okay.
I do, because it helps for if you have if this side has paralysis, it doesn't get stuck under you.
Okay.
So yeah.
So you always do the leg with paralysis on top.
The leg with the paralysis.
The leg on top.
What's this, right? Because when I deliver, it's gonna be the opposite.
Right. Okay.
Okay? You ready? On the count of 3. 1, 2, and 3. Okay. Stay there. Pull your arm under you. Okay. And I want you to roll it back. Okay. Now, with a draw sheet, I'm gonna do what?
Pull her.
Bring her more to the middle of the bed. What if I leave her there?
She's gonna fall.
She could potentially fall, right? So now, being that this is her unaffected side, she's gonna do what? What is she gonna do now? She's gonna assist me to scoot over to the middle of the bed, right? So now, Miss Rayleigh, on the count of 3, what I want you to do, same thing, I want you to push yourself over towards me. And I would have a draw sheet here and allowing her to assist me on the count of 3. 1, 2, 3. 1, 2, 3. Okay, good job. Are you okay? Yeah. Are you sure yourself? Okay, so for her, right side unaffected. You want how many pillows would you want at your head?
1.
Is that good? Really putting it under this knee. Why?
Because
It can potentially contract. this pillow is really fluffy. So what I would do, I would fold it in half here. Because you want those heels to float. Make sure she has no wrinkles, of course. And you want to bring that foot up here.
And it'll stay there? The foot will stay?
Well, I'll tell you to make sure that you keep that foot up. And educate the people,
And then they
and
have
everybody
the
to come
boots
in.
too,
and
that
then
they
have-
put on.
right.
to keep it.
Mhm. So this is my upper body, lower body, everything is in alignment there, okay? So this is your pillow placements for a right CVA, supine, or a left CVA, supine. It'll be just the opposite if it was the other side. Yes, ma'am.
This isn't like the same kind of position that we're talking about, but my